Okay, I'm going to talk through the breasts now too, but I also forgot to do the Phalen and the Tinel test. So I'm going to have you go like this. This is testing for carpal tunnel. I'd have you stay that way for 30 seconds to a minute. If there's numbness and tingling, that's what would be indicative of carpal tunnel. And then the Tinel test, I would flip you over and go right on the medial nerve and just kind of tap. And if it made your hand numb or tingly, that could be indicative of carpal tunnel also. Then I'm going to talk through the breast. So I would start with sitting up. And I would first inspect the breast. I would look at size, vascularity, shape, nipple placement, any sort of drainage that could be coming from the nipples. And then I would look for orange peel skin. I could have them lift their arms up, put their hands on their hips, flex their chest muscles, and then lean forward. I would look for any dimpling of the skin, any orange peel looking skin. And then I would palpate through. I would start in the axillary. I'd go high up in the axillary into this, into the lateral side of the arm. And then I would go all the way through down the down the anterior to the posterior axillary lines, all the way down the chest wall. And then I would have the patient lay down and I would again palpate the breast. I'd go from the inframammillary line all the way up to the clavicle, from the mid-sternal all the way over to the posterior axillary, going in a vertical motion. I was taught you always go circular motions and you go soft to deep, and you just keep going, doing that all throughout the breast tissue. And then I would look for any masses, and then I would palpate the nipple and the tail of Spence. I would also look at the lymph nodes. So I'd look at the pectoral, the subscapular, the central, the lateral, and then again, I already did these, but the supraclavicular and the infraclavicular, noting if there's any increased size. And that should be it.